Who knows?
Who knows?
You know, we've been saying it for how long? President Theodore Roosevelt, remember, early 1900s, he wanted to have a universal access healthcare system. He was familiar with the Bismarck system in Germany. President Truman considered it a negative, and I'm not thinking of the word right now, a failure of his administration that he did not gain access. President Kennedy didn't get to finish some of the things he desired, but it was in his perspective too, forecast. President Johnson strove very hard for the 1965 passage of Social Security and Medicaid. Those were incremental solutions to a universal problem. And we do spend more than any other country per capita. And as you've said, without the same results. But we have all that evidence, but because of our traditions and philosophical perspectives, we've not been able to make overarching or macro changes in policy. We've been incremental. We have the state children's health insurance program, CHIP or S-CHIP, which came in 2000. So I don't have an answer to your question.
Well, it's very difficult because healthcare is a big business in the United States. And what's happened is a lot of the hospitals that started out as private individual entities have now been absorbed under corporate umbrellas. So you have one, and we have one in our community, one hospital that started out as a single entity, and then it picked up another hospital and another hospital and another hospital, and now they have 12 hospitals and I think 24 or 30 long-term care facilities. They've created a whole corporate network of healthcare facilities, and it's a big business. And so the problem that you've got in terms of healthcare delivery is that it's
I was being nice. I didn't want to call it a big business.
It is a big business.
She's telling the truth.
It's a big business. It is about making money, and when there are changes in how care is delivered, it's about efficiency and cost, not so much about outcomes.
Well, at the same time, we do have our triple aim in our country.
Right.
And we're striving to integrate that into health professions education, into systems for reimbursement, government-based reimbursement. Many times, often though, private follows government. And so if we don't have good performance indicators, which is what they're calling them, if we don't have good quality patient experiences, safety as well as quality, if we don't have relevant and efficient use of resources, if we don't have, most importantly, good health outcomes or better health outcomes, then as a system, we know that we are failing. One of those three of the triple aim is not good enough. It has to be all three. So there are carrots and sticks that are pushing for a different healthcare, and where reimbursement follows, changes happen. So now it's a change for us. It's a paradigm shift in that we're being told we should not be reimbursed by procedures, but we should be reimbursed based on our outcomes. So it's just starting, and it's not something that'll happen tomorrow.
But that ability to do that is only as good as the leadership, I was going to say corporation, but the leadership of the healthcare delivery system in your community is.
Yes.
It is truly dependent upon who's driving all of those decisions and how well they interface with the community and the different care providers in the community.
And I was thinking you were going to say who's driving the bus.
I almost said.
I know you were, and it's true.
It's true.
Because who's driving the bus But now we don't have gas for the bus if we don't have better outcomes.
Right.
And so if we're looking for federal dollars for Medicare dollars and Medicaid dollars, they're saying you better have better wheels on that bus.
But, and so then you have the healthcare systems that have the 12, 20, whatever number of healthcare facilities that are under their umbrella. And then you have this other healthcare system in a more rural area that maybe has one or two. The disparity in the resources between all the healthcare systems is going to drive decision making and their ability to generate the kind of outcomes that are expected.
Right.
Because their resources that they have available is going to be different. And so they may have the people here in the rural community may have a real desire, but they may not have the same type of workforce. They may not have the same type of resources. And they may not have the same relationship with their customer.
So I'm going to put this on the table. I'm going to be bold and crazy. So that's why you have a centralized government that provides policies and legislation and rules and regulations like ones we've observed in other countries. We just come back from looking at the NHS system in the UK, for example. And so when you have a system where it's someone else other than the corporations that decides who gets the resources. So if in Vienna we have a need for more resources in mother-baby, the maternity area, whereas here in Salzburg we have a need for more resources related to mental health, it is the governmental structure that determines the allocations of those resources. And then you take all of that, what we're dealing with, out of the mix. You have standardized pay system structure for the healthcare providers. So, that's a really big shift, and I'm sure I won't see it in my lifetime.
No, you won't.
No, I won't. I will not see that. But maybe one day someone will tell me of it, because I won't see it.